Hi everyone and welcome to Periodontist, the video show that keeps you abreast with the ongoings in the field of periodontics. Today's show is dedicated to the role of regeneration in the treatment of furcation involvement. Regeneration, well, it's a goal that every periodontist aspires to. Regeneration actually is quite different from repair. It involves the rebuilding or reconstituting three basic tissues that are lost in periodontal disease. That is periodontal ligament, alveolar bone, and cementum. The market is flooded with different regenerative materials, and we have different regenerative procedures that are employed in treating gum disease or periodontal disease. For furcation involvement, we have different techniques again. There are bone grafts, and these bone grafts can be allogenic bone grafts, alloplastic bone grafts, xenografts, or autogenous grafts. Then there are growth factors, and that include regenerative gels, and then there are occlusive membranes that includes both resorbable as well as non-resorbable membranes. So there are different ways of tackling the same problem. Regenerative procedures are quite commonly used to treat teeth with furcation involvement. Take the example of this particular case. Now, this lady came to me with a very deep probing pocket depth on the lingual of tooth 4-6. She had regular non-surgical periodontal treatment followed by open flap debridement and guided tissue regeneration. I used BIOS, which is a xenograft, and BioGuide, which is basically a resorbable membrane to actually help treat this particular tooth. And yes, 9 months after, the x-rays clearly showed and the clinical examination clearly showed almost a complete resolution of the problem. So this is not an isolated case of success. Guided tissue regeneration is used with a lot of success in grade 2 mandibular furcation area, and that has been proven in many studies. However, when we take the case of grade 2 mandibular furcation area, the success is limited. And so is it limited in case of grade 2 and grade 3 maxillary furcation area. So yes, the studies clearly indicate that grade 2 mandibular furcation area can be treated quite well with guided tissue regeneration. What about regenerative gels that are being employed today? Endogain is one of them, and I use it quite a lot in my practice. And I find, as has been shown in previous studies as well, that it works really well in mandibular grade 2 furcation area. But its use is limited in case of grade 3 furcation area, and that includes both mandibular and maxillary furcation zones. So what are the factors that determine the success of a regenerative technique in furcation defects? These factors can be broadly divided into two major groups. There is a systemic factor, and then there are local anatomic factors. The systemic factors include uncontrolled diabetes mellitus and other conditions that affect our immune system. Again, smoking has been directly associated with detrimental effects in the treatment of furcation defects by means of regenerative therapy, and that was proven even back in 1990s. So those were some of the systemic factors that have a bearing on the success or failure of regenerative therapy in the treatment of furcation involvement. Let's now come to the local anatomic factors. One of the biggest ones is the classification or degree of furcation involvement is one of the key points which can actually impact the regenerative therapy's success. The grade 2 mandibular furcation, for example, is much easier to treat or much more predictable actually to treat than a grade 3 mandibular furcation area or maxillary grade 2 or grade 3 area. The convergent root cones are a big issue, and so is the root proximity. Another point is the position of interproximal bone. If we have a very good height of interproximal bone, the regenerative response is actually quite good. The other problem that we find is that sometimes the periodontal biotype is actually quite thin, and it can be a very big problem when we are raising flaps. So a thicker gingival biotype is definitely more desirable when we are treating teeth with regenerative therapy. Other than that, we're also looking at factors such as initial probing depth and vertical dimension of the furcation involvement. So the take-home message is that regeneration in teeth with furcation involvement is the ultimate goal. And there is an interplay of multiple systemic and local anatomic factors that have a strong bearing on the success of regenerative therapy. Most importantly, no one case is similar to another one. I hope you have enjoyed today's show. If you have any queries regarding what we have talked today, please send your queries through an email at www.periodontist.com. And I'll be seeing you again for another session of Periodontist. Till then, keep smiling.